As the country marks 16 days of activism for no violence against women and children, again, the handling of child abuse cases has come under scrutiny. Reported child abuse cases are falling through the cracks. In 2017, a UCT study found that only 19% of child abuse cases in KZN and the Eastern Cape were referred to the police by social services. But now there's a glimmer of hope with the establishment of the National Strategic Plan on Gender-Based Violence. To discuss this more, I'm joined by Dr. Shaheda Omar from the Teddy Bear Foundation for Abused Children. Thank you very much, Shaheda, for joining us. As always, a pleasure to have you on eNCA. There have been so many cases of rape, abuse, violence and the murder of adult females in South Africa over the past while that perhaps we as the media and South Africa at large have forgotten that the wider scope of the gender-based violence problem in South Africa touches children very, very directly. How many children, has the scope of the impact on children increased under lockdown and during the pandemic?
So absolutely, Annie. I think during lockdown, children and families were confined to the indoors because of the social distancing and protection protocols, and the fear of reprisal, fear of being rebuked by law enforcement often resulted in children and women being trapped, immobilized, and not able to access any online support which was available, provided by government and by other civil society organizations. So your child lines, the command center for gender-based violence, but those were not accessible because of the coercion, the intimidation that they were faced with in the confines of their home environment. However, what we have seen is immediately, of course, during the lockdown, some of them managed to escape, or where family members or friends were able to ask for help and were able to seek some kind of support. But many fell through the cracks, and the aftermath of that is that we're finding a lot more people, women and children, coming to organizations for support, for interventions. What we are seeing is that a lot of children who have witnessed the domestic violence have also been victimized and traumatized, because there's often a co-occurrence of domestic violence and child abuse. We know that more than 50% of children living in cases of gender-based violence are subjected to intimidation, coercion, threats, and even physical abuse, and of course even sexual abuse. So I think this is something that we are seeing more of now, but we are also seeing the challenges around that, because when mothers and women have gone to report this to law enforcement, they've often been failed at reception level, at the station level, where sometimes due to the lack of support or people feeling quite overwhelmed, police officers feeling quite overwhelmed and not being able to respond appropriately or adequately and timelessly, some of them have been subjected to further abuse and forced to return home. And we find that the children that have been referred to us are children who have been extremely traumatized, who have shown regression, depression. We've seen attempted suicides. So, violence against women and violence against children reinforce each other. And therefore, GBV approach and the NSP is certainly critical in trying to disrupt the scourge of violence.
Why is there such a discrepancy between the number of reported cases and the number of reported cases referred to the police?
So the number of cases, we know that the statistics as we speak are still underreported, frequently reported. And I think the reality is that people realize that the response that other victims are receiving are not adequate, and that they feel that justice is denied, justice is not being fulfilled, because sometimes cases are opened, protection orders are instituted, but bail is granted to the perpetrator. So it's the right of the perpetrator as opposed to the right of the victim. And what we are seeing, a strong trend that is emerging, which has been prevalent in the past, but even now, as we speak, that more and more victims who have reported and cases have been opened, the perpetrators, alleged perpetrators, are granted bail without the victims being informed, and they learn about it afterwards. And the fear and the anxiety levels escalating. So the secondary trauma that is induced as a result of that is certainly having a very negative effect and impact on the victims.
Shaheda, our national strategic plan makes adequate provision for curbing these incidents of violence and abuse of women and children, but somehow implementation always falls short.
Indeed.
We are running out of time, so I'm going to have to ask you to keep your answer
Okay,
brief.
so Anlie, you're absolutely correct, because the policies are brilliant, but it's the implementation, and we're finding that on the ground where the challenges lie, with law enforcement, with court officials and their responses, and where victims are not adequately informed about what is going on in the processes, and that is where we're failing our victims, and they're subjected to further trauma.
Thank you so much, as always, for your time, and thank you for the work that you do.
Thank you.
That was Dr. Shaheda Omar, Clinical Director of the Teddy Bear Foundation for Abused Children.